Hi, it's so nice to do this today. Taking some time out of the morning to talk to you all about birth debriefing. And for those of you who've seen the stories that I put out this morning or been on my email list, you'll know that the reason I'm doing this live today, is that I am getting a lot of questions recently. I've been getting a lot of questions about birth debriefing. Hi, Sarah. Hi, everyone. I want to answer some of your questions today. So if you have a question, pop it in the chat for me. And I'll see it pop up on the screen and I'll do my best to answer it. But basically, we're going to be talking today about birth debriefing, the evidence for and against birth debriefing, how to debrief in the best possible way that's going to serve you. And I guess the other thing that I really wanted to cover today was who to debrief with, because I think that's a really important thing for us to think about. And I know that it's not always easy to know where to start when you're thinking about wanting to debrief your birth. And so, yeah, let's have a chat about all of that today. So firstly, what even is birth debriefing when we're talking about birth debriefing? Essentially, it's an experience where you might go and meet with someone and take some time to talk about what happened in your birth. And that obviously includes before, in the lead up to the birth itself, and after. Thanks, Sarah. There are many different options when you think about who to debrief with. You can do it with a midwife, a doula, a mental health kind of counsellor, and it's also routinely offered by the hospital or your obstetrician after a birth experience that might have been complicated or included some kind of obstetric emergency, which can be different because there isn't that counselling element. And I think that's something that's kind of important to understand. So birth debriefing usually happens in the first few days or weeks after birth. And it's really ideally, and I think this is what most people are seeking when you go and try and debrief your birth, you're seeking a safe space to talk about everything that you experienced, everything that you went through, and to also share the feelings that you felt at the time, and potentially everything that stayed with you about that experience afterwards. So if you think about this, I think there are a lot of benefits of birth debriefing, which I'm sure you can probably think of yourselves if you're sitting here with me. If anyone's had a birth debrief, I'd love to hear from you about who you decided to do that with, what was useful, and how you found it, basically. And any tips you have for people who are seeking a birth debrief at the moment, pop them in the chat for us. Essentially, I think the potential benefits of seeing somebody to debrief your birth experience is that it enables you, first and foremost, to make sense of what happened. Because birth can be long and there are many twists and turns, and we're in and out of the zone of kind of being present in reality. There's a lot going on physically, mentally, emotionally for us when we give birth. And so often things happen quickly and we are left with a lot of confusion. And I think if we think about what happens when we get to go and debrief our birth, one of the main sort of benefits of that is being able to have your questions answered, have a different understanding about why certain things happened, what the reasons for that might have been, what could have happened if that decision hadn't been taken by you or had been suggested by staff. And so you get an opportunity to reduce some of the confusion that can exist around birth. And I think the reason that can also be helpful is that it can change your perspective sometimes on what happened. So if we think about a lot of the difficult feelings that we're often left with after a difficult birth, often there are feelings of failure, there are feelings of guilt. Those are probably some of the biggest ones that I see parents struggling with after birth. And I'm sure if you work in this space or if you've been through this yourself, you would probably agree that there can be this failure and guilt, and being able to debrief your birth can give you new information, new understandings, and new insights that can change your perspective on the experience and leave you able to go forward feeling slightly differently about what happened. So that's often very valuable. The other thing, even if you don't get that perspective shift or new information that changes how you feel, the other potential benefits of debriefing your birth is that you just get an experience of sitting down and really being able to gather up all the different pieces of what happened, how you felt, and have that opportunity to express that and have it acknowledged and validated. So to be able to sit with somebody who understands birth, who understands how important it is to us as mothers, as parents, and have a space where you can verbalize and feel and talk about your anger or your sadness and your grief, and actually how scary and terrifying certain things were, and be able to have that held, can be very helpful for us in being able to then move forward feeling slightly lighter. So these are some of the different ways in which birth debriefing can be helpful, I think. Being able to have questions answered, make sense of what happened, less confusion, being able to have a space where you can emotionally sort of express and organize what happened for you, and potentially bringing all of that together to change your perspective and actually move away from the birth and into the next chapter of your parenting feeling lighter and with a different perspective and different understanding of what happened, which can reduce feelings of guilt or failure. Now, the importance of thinking very carefully about this, because I wanted to talk today specifically about how birth debriefing can be helpful, not harmful, because actually there isn't solid evidence for birth debriefing. And this is something that I don't think is very widely understood. And we actually means that we need to think carefully about, if you want to debrief your birth, what you're doing that for. And to make sure that you're aware of potentially some of the risks that might sit alongside those benefits, and are clear, I guess, on what is going to be useful for you. So actually, when I say there's not much evidence for birth debriefing, I don't know if you guys know about like the Australian Clinical Practice Guidelines or the NICE guidelines. It actually says do not offer, so this is the NICE guidelines, do not offer single session, high intensity psychological interventions with an explicit focus on reliving the trauma to women who've had a traumatic birth experience. And sometimes that's what debriefing can look like. It's like talk through the birth in lots of detail, and we're reliving that experience as we're talking. It's not recommended to sit and do that shortly after the birth. The Australian Clinical Practice Guideline says that there's no evidence for debriefing after a traumatic birth. Now, that doesn't mean that it's not helpful, okay? I think the idea of a debrief feels intuitively helpful. But the thing is, first of all, it may not be for everyone, and there's things to think about whether it's going to be right for you. But secondly, when we say there's not enough evidence to support it, and these guidelines are saying there isn't enough evidence, what they're essentially meaning is that the research, when we look at what helps after a traumatic birth, the research shows us that it doesn't actually reduce depression symptoms or PTSD symptoms enough for birth debriefing to be recommended. So if you think about what that means, it means that when they've done lots of studies, and there's a review that's coming out soon by Decker actually, which is a really good review of the literature, which I'll share in my stories after this so you guys can read it. But when we look at the research studies that have followed women who've done a birth debrief shortly after a difficult birth experience or a traumatic birth experience, there isn't enough research studies that show that that actually flows forward for those mums to give them a reduction in symptoms of depression or PTSD down the track. So when people say there's not enough evidence for birth debriefing, that's what they mean. They mean that there's not enough evidence that it reduces symptoms further down the way. Which is obviously really important, because that's one of the reasons why you might go and debrief your birth, is that you're hoping that it might help you to feel better and have a better experience postnatally in terms of your mental health, of course. So just to be aware, that doesn't mean that it's not going to be helpful for you. It just means that overall there's not a strong amount of evidence to say that this really reduces symptoms and improves mental health going forward. The other thing to think about, and that we need to be aware of, and this is a risk that I think a lot of parents do sometimes think about, is that going to debrief your birth experience can potentially be re-traumatizing. And this is why I think the NICE guidelines say do not offer it, to people who have this highly intense reliving the trauma in a single session after a difficult birth experience. Because if you think about it, sometimes taking an hour, 2 hours to go back and go through that birth experience in this really intense way can activate all the symptoms of trauma, bringing all those memories and thoughts and feelings back up in your mind and your body, but not in a way that helps your mind and body to actually process that. So as a trauma-informed psychologist and treat trauma, there are particular things that we do, and there's particular things that we know about the brain that can help us to process traumatic memories and move them across into long-term memory storage which I guess if you're debriefing your birth, that may not be happening. And what the risk can be is that we're activating that memory of that birth, and then it's all very kind of raw and triggered back up again. And then people talk through their birth experience, potentially like at the hospital or, in detail, and then are left feeling potentially more traumatized afterwards. Obviously, we don't want that. We don't want an experience of going to talk about your birth being distressing and making you feel worse, not better. So I guess that's one key thing to think about, is how much trauma and distress you're experiencing. If a little bit of time has passed after your birth and you're having lots of difficult feelings and thoughts about it, but you're not experiencing flashbacks and nightmares and finding it very traumatic, then maybe going to have a birth debrief could be wonderful. It could really help you to understand what happened, process what happened, make sense of things, as I said earlier, and move through some of the difficult emotions that are sitting there for you. If, on the other hand, there is quite a lot of unprocessed trauma sitting there for you, and there's lots of flashbacks and nightmares and sleep disturbance and hypervigilance and high anxiety all the time, an ongoing feeling of threat, then potentially a birth debrief, just going and talking about that birth, may not be the right thing. And making sure that you do that with somebody who's trauma trained and can actually kind of assess the trauma. And it might not be a single debrief, then it might be a number of sessions and more like trauma therapy. So that's different. And we can think then about managing risks of traumatization and make sure that your birth story is treated and taken care, and you're taken care of in the way that you need. Now, this brings me back to thinking about who to debrief with, which is one of the questions that I wanted to answer for you guys today, because I think there are a lot of options here and this can be quite confusing. When we talk about birth debriefing, there's actually many different types of birth debriefing, and then there's therapy, and they are all going to be slightly different and have slightly different impacts for you, I guess. If anyone has a question, again, I can just see people joining. Hi, Pete. If you guys want to pop any questions in the chat, I'll try and answer them as we go. And I know some of you have sent questions in ahead as well, which I'll get to. So we're talking now about who to debrief with and the different types of debriefing. What are the options, and does it matter? My answer would be yes, it does matter, because you want to think about who that person is that you're going to trust to hold you through this process of debriefing your birth. The options. The first option, which I think a lot of people are offered as standard, is to go back to the team, the hospital perhaps, where you had your birth, and debrief with them. And this is something that's still routinely kind of offered to women after a traumatic birth experience, even though, as I said before, some of the evidence for this is not there in terms of improving depression and PTSD symptoms down the track. It's routinely offered by the hospital, and I'll come on to kind of what that looks like. So that's one option. The second option is to debrief with a midwife or a birth professional who is not part of your team and at your birth, but has a lot of knowledge, obviously, about birth. And often those midwives who offer birth debriefing are trained in counselling as well. So I think that's a wonderful option, because you've got a lot of wealth of knowledge about birth that can really help you understand what happened. And you've also got that counselling element to the whole experience, which is deeply important in processing the emotions that we're left with after a difficult birth. Third option, potentially, of offering a birth debrief would be with somebody. You could go and see a counsellor who's perhaps not a midwife, but they're coming more from that mental health background or counselling background. And I guess they may or may not know a lot about birth. So I guess my sense is that if the less somebody knows about birth, potentially the less helpful debriefing might be. I don't know what you guys think, but when we talk, birth is so complex and there are so many things that happen, and things like control and consent and communication are so important, and the systemic issues that happen in our hospital system and so on are also really important to understand. I feel like the more somebody understands about birth, the more helpful that debriefing kind of counselling is going to be. Although, if you were going to debrief somebody who knew a lot about postnatal mental health or sort of traumatic experiences in general, there's still a lot of value that could be done from that counselling, right? The last option would be, as I said before, therapy, and more kind of trauma-focused birth trauma therapy, which was less of a single birth debrief and more of addressing the ongoing sort of thoughts, feelings, difficulties that the difficult birth experience has left you with. Yeah, Sarah's just added, I think any birth professionals can help to fill in the gaps and consolidate the story. I think that's really true. That's often, I think, what I was talking about before about that confusion, right? Like, we don't have all the knowledge and all the information. We often need to be able to ask questions about birth specifically to help us piece together that puzzle and go, oh, okay, that's why that happened. Okay, that's very helpful to know and understand. Yes, there's just a comment here from the family room. I've seen people re-traumatized after seeing a therapist who knows nothing about birth. Yeah, I agree, right? Because I think about, it's not something when you work in birth, or you're kind of in it yourself. It's almost difficult to remember that there are whole swathes of professionals that might be trained in trauma, even, but not understand about birth. And I just don't think it's going to be as helpful to get in there into the details of, what that specific decision potentially around, let's say, like a stretch and sweep, or whether to have had that check, or what it means to have been induced at that point or not at that point. Hi Holly, what it means to have been induced at that point or that point. It's not going to be the same if someone can't get into the nitty-gritty of that birth with you. Yeah. Okay, speaking about getting into the nitty-gritty of the birth, debriefing with the hospital. This was one of the options that I mentioned before, when we're just running through the options now. For those of you that are joining now, we're just running through the options of birth debriefing, and I'm sort of talking a little bit about the different ways in which you can debrief your birth, the different people you can do that with, and what might be more or less helpful. So debriefing with the hospital, as I said, often routinely offered if there's been some kind of complication in the birth. And the potential benefits of this is that you get to go back to the people who were in that birth with you, providing your care, go through your notes, and get some answers from them about why certain decisions were made, why certain things happened in the way that they did. Now, this can provide some of that really important clarity that we talked about before, but I know that sometimes families find these birth debriefs upsetting or unhelpful. And again, if you've had an experience of this with your hospital, or if you've worked with women where this has happened, do let me know in the chat. I'd love to hear your experience. The challenge is here, I think, is that you're going to be going to get answers from the professionals who are involved in your birth. And sometimes the hospital can be actively trying to protect their own interests. So my concern with those kind of birth debriefs is that it can lead to further trauma and distress if there's kind of a defending of certain decisions rather than a willingness to sit openly with you and explore what else could have happened. I do know some people who have gone to the hospital and had amazing conversations where their obstetrician have apologized and said that shouldn't have happened. But yes, often there is a defensiveness. If there's an apology, that can be deeply helpful. It can actually be enough in an interpersonal way to kind of begin to repair. At least that was acknowledged, at least there was an apology, at least that I was heard, right? But I think often you're getting a defensiveness and justifications. And I mean, if we think about like the New South Wales birth trauma inquiry that happened recently, debriefing is often, and this came up in the inquiry, that they're trying to protect themselves from litigation. Exactly. And it can be a rationalising of why these interventions were needed, which is obviously going to come from medical model as well. And potentially, if we think about the over medicalisation of birth that we're seeing, this is just going to be justifying those decisions instead of potentially helping you to work through and think about that from a broader perspective. So if you're going to go and debrief with the hospital, I think it's just about doing it with a really clear understanding that you're going to be going to ask questions of them to learn their perspective and their position, and just holding in your mind that that may not necessarily be fact. There may be that you want a second opinion. You might want to take your clinical notes and request your notes, and either also or instead go and see a midwife, a privately practicing midwife who does birth debriefing, who can talk you through those notes, again, still from a medical perspective, with someone who's trained in birth, who can talk you through your notes and help you to understand what might have happened here. And this is where we can sometimes get that really helpful perspective shift around, oh, okay, maybe I wasn't given enough time to labour, and it wasn't failure to progress, but it was failure to wait. things like that, right? Like you can think about, well, I should have been offered a choice here. There was another option and I was never offered that choice. That may not come up in a debrief with the hospital directly, but it might be really something that comes to light when you can sit back with somebody else who's trained in birth, who has your notes, who can talk through your birth story with you, and you can begin to make sense of what happened. Now, that doesn't always mean that it makes it feel okay, of course, but we often want clarity. And if there are things that you're left confused about, or if there are things that you're feeling guilty about, or are carrying any sense of failure about, that is where it can be very, very important to bring in an alternative, kind of more neutral, unbiased, medically trained, birth trained professional who can give you a different insight into what happened during your birth experience. So that's just something to think about with the hospital debriefing, because we don't want it to cause more distress. We definitely don't want it to reactivate trauma and be re-traumatizing, and adding any more kind of negative feelings and leaving you walking away feeling more distressed about what happened at your birth. Now, as I said, I just covered there why debriefing with a privately practiced separate midwife might be amazing. I was talking earlier, for those of you who have joined more recently, that when we say that evidence for debriefing is mixed, what that's based on is that there isn't enough evidence to suggest that it reduces symptoms of depression and PTSD down the track. But if you can actually, interestingly enough, actually, just as an aside, even in those studies where they measure how somebody experienced their debrief, and they measure depression symptoms or PTSD symptoms and compare it to a group of people who didn't do a birth debrief, even in those studies, there's often, anecdotally from the people who take part in the study, they found the birth debrief helpful. So I think this is telling us that somebody may still have symptoms of depression or PTSD from what happened, but the experience of debriefing with somebody who's independent, who's kind of trained in counselling, who can bring that opportunity to reflect and process and make sense of what happened, people generally find that very helpful. Now, lastly, one of the questions that I had was how therapy is different from a debrief. And I guess there's often there can be a bit of crossover here. Usually when we think about therapy after a difficult birth experience or for birth trauma, this is taking place over a number of sessions. So a birth debrief might just be one long session where you meet with somebody, not always, but that might be how it looks. Therapy would usually be more than one session, and that might take place over weeks or months or potentially even years. And the idea of that is that it's designed, the goal is a bit different. It's not just about going through specifically making sense of the birth. It's also about helping you deal with any kind of emotional, psychological, ongoing issues that have stayed with you relating to that experience, and helping you to gain insight into how that's still affecting you now, recognize any patterns that are keeping you stuck and keeping that going for you inadvertently, and then helping you to develop new coping skills and strategies to manage any ongoing difficulties that might be happening there. When you're working and you're doing therapy, it is important that we are looking broader than just the birth. So we're also looking like, this birth has happened, but what's the deeper context of you, your life, your other experiences, your relationship with your baby, your partner, even your family, if that's relevant. I think the focus is probably more on the problems that you might be having now that relate to that birth experience, as well as just the specific events of a childbirth. So as I said, I think that really helps then if the therapist that you go to see has a decent understanding of birth, not just trauma, or, I think if you get to go and see somebody who's perinatally trained, has experience in birth trauma, has worked with women navigating that postnatal period after birth, they're just going to have a stronger understanding of your birth story and help you to be able to reflect on that in a slightly different way, and be able to have the training and the experience to treat any trauma that is still sitting there for you in a way that is hopefully going to really help you be able to move forward feeling different and feeling lighter, and shift the difficult thoughts and feelings that can stick around, and any symptoms of trauma that are sticking around for you. Was there any questions from anybody that people wanted to ask before? I got a question through earlier about debriefing for parents who are neurodivergent, which I think was a great question. We know that there is a higher risk of trauma, including from birth. And I wanted to just touch briefly on that. I mean, if you're a parent who is neurodivergent, going to debrief your birth, if possible. Obviously, we're saying we want somebody who's got a good understanding of birth, but also somebody who is neuroaffirming and practices in a neuroaffirming way is going to be important. And what that means is that we're really just seeing neurodiversity as part of the human experience. They're wanting to understand you and how you experience the world differently, and how that may have impacted and been part of how the birth went and how the birth was experienced by you. So, I think asking somebody, are they, do they practice in a neuroaffirming way? Have they done additional training on birth and trauma and neurodiversity? Those of you that work in this space, I know there's a couple. Sarah, you're here. Do you guys have anything else that you would suggest around what somebody could look for, or how somebody could seek out a neuroaffirming practitioner to debrief their birth with? Because I imagine that's actually not easy to find. Like, I'm talking about actually reaching out and actually asking them, are you the right person for me? Reframing Autism has a great checklist. Yes, I saw this, Sarah. You shared that earlier. That's true. I will share that in my stories as well today. There's a checklist that you can go through there about how to tell if somebody is neuroaffirming. And there, I know some of the stuff that stood out for me there around just like some really wonderful things to look for in terms of additional flexibility in the way that they practice, and an awareness that would come through in just how everything was set up. So that would be something like I'll share that checklist in my stories later. The other thing, I guess, if you are wanting to offer debriefs and you're as a professional, if you're here and you're wanting to think about how you might be able to better support neurodiverse individuals, I think like doing some additional training. There's a lot of great training around at the moment. Being aware of the impact of sensory sensitivities in birth, things like touch can be being difficult, or pain not being experienced or communicated in the same way. These if you can have that awareness that these might be factors in how birth may have been experienced, you're going to need to be looking at the different layers there of what happened for people during their birth, with a really clear understanding that those things that we always talk about as being important, consent, communication, control, thinking about these through a lens of how information may have been communicated or presented during birth, and how there may have just been many additional pockets of opportunities for things to be experienced in a really difficult and potentially traumatic way. So the more you can educate yourself as a birth professional about neurodivergence, and it's an ongoing learning that we always are doing as professionals, right, to try to better serve the parents and the families that we support. And I think really directly, working with somebody who is neurodivergent, opening up that conversation about how they think that may have impacted their experience of the birth, and helping somebody to make sense of the different pieces and how it may have all come together for them. If anyone has any other questions, please do yell out. I know we've been going for about half an hour now, so I might wrap up soon if there's no more questions from anybody. The other thing that I just wanted to share before I go is that I am about to offer new dates for my birth healing program. So just kind of a coincidence of talking today about debriefing. This is a group that I offer. It's not a debriefing group, so it's very different to what we've talked about today, but it is a therapy, group-based therapy program for parents who have experienced a difficult birth experience. I am going to offer one more group before the end of the year, so we are starting on November 6th, which is going to be a Wednesday afternoon, evening, depending on your time difference. And I know a lot of people have wanted a later time. I've usually been offering these groups on kind of a Monday morning or different times. And so this is my first time offering one in the afternoon, evenings. And we will see how that goes in terms of if that works for some of you who've not yet been able to join that group, but have wanted to. So if you know people who have had a difficult birth experience, if you yourself are thinking about wanting to take an opportunity to work through what has happened for you there. As a group program, this is a little bit different from debriefing. There is no need to talk about your birth experience if you don't want to. You can share as much or as little as your experience in the group. What we really focus on is the emotions that have stayed around for you after your birth. So it's designed to help you reflect on your own experiences, and there are exercises that we go through each week in the program, and then also for you to be supported to work through the emotions that are sitting there for you. And I think it really helps to do this stuff alongside other parents who understand, which can cut through some of the isolation that can really be felt when you have a birth experience that sits outside of what you may have seen around you or what other people are talking about around you. So everybody in the group has their own unique experiences of birth, of course, and there can be a wide range of different experiences in the birth. No one can tell you, oh, that doesn't count as traumatic. It's your experience. And if there are parts of your birth that have stayed with you that are distressing in an ongoing way, that continue to pull at you, then I'd ask you to come and consider this group, whether that might be helpful for you. We're going to look at the specific emotions and thoughts and feelings that can stick around after a difficult birth. And you come away with a lot of tools and strategies that you can continue to use in an ongoing way around your birth experience, but also I think more broadly in motherhood. So if that's something you think you'd be interested in, if anyone might be interested in that group, please do. I'll be sharing a lot about it in the next few weeks. The group is pretty small. I don't go into big group sizes, so there's a limited number of spots. I offer a payment plan. You can read all the details about it later. But anyway, I agree, Sarah. I think it's one of the reasons I wanted to set up the Birth Healing Collective, is that so much of this work happens in little one-to-one groups. Even if we're thinking about birth debriefing today, it's a one-to-one experience, which is often very helpful, and the privacy and the safety of that is key. But sometimes we also need to be around other mothers, and when women and mothers and parents come together, I think it can be incredibly powerful. There's a lot that we can offer as professionals, but there's much more that women can offer each other and mothers can offer each other. And I've definitely found that as a mum myself, that's often where some of the stuff that can be the most helpful. So being with other mothers, other parents, other women in these groups, as you work through this process of reflecting and learning the strategies to move through different emotions and respond to your own emotions differently, I think that in itself can be very healing. So that's my birth healing program. I'll share more about it soon. If you have any questions about it, do get in touch with me. But thank you all for joining me today for this little live. It's been really great to hear your questions and your perspectives. I really value that. So thank you for coming along and being part of it. And I'll be doing more of these over the next little while. So keep an eye out. If you want to jump on my mailing list, I always let people know a little bit ahead of time as well. So you can set some time aside to come along. Thank you all very, very much, and have a lovely Monday. Thank you. Bye.